So when we look at the heart, anterior view of the heart, I want you to remember a couple things. There is an anatomical base of the heart, and then there's an apex of the heart. So like an upside down pyramid, the flat side would be here, the base of the heart. This is where we find the great arteries. The apex of the heart is down here. Okay? This groove in here is called the coronary sulcus. We have also an anterior interventricular sulcus, interventricular, between the two ventricles. On the posterior side, we have a posterior interventricular sulcus. Okay? So if we remove this, we're going to look at some of the internal structures. I'm still going to follow blood flow through because that's usually what makes the most sense. So deoxygenated blood is going to come in from the superior and inferior vena cava into the right atrium, and that deoxygenated blood is going to pass through a valve. It's a one-way valve. All of these valves that I'm going to describe are one-way valves, but this is the right AV valve. It's called the right atrioventricular valve. It has another name to it. It's what we call the tricuspid valve because it has three cusps or leaflets to it, which anchor themselves all the way down at these papillary muscles by way of these chordae tendineae, cord-like tendons. Okay? So blood moves from the right atrium past the right AV valve down into the right ventricle. When the ventricles contract, this blood gets pushed up the pulmonary trunk, but it first has to pass through the pulmonary semilunar valve. Think of pulmonary, think of lung function, a pulmonologist. Okay? This is the pulmonary semilunar valve, semilunar because it has a semilunar or partial moon shape to it. This then carries deoxygenated blood out to the lungs. Oxygenated blood comes back on the pulmonary veins. Pulmonary veins come into the left atrium, and then from the left atrium that blood is going to pass through the left AV valve. The left atrioventricular valve, or the left AV valve, actually has two other names to it. We call it the bicuspid valve because it has two cusps to it. It's also known as the mitral valve. Okay? Also connected to papillary muscles by way of these chordae tendineae. Oxygenated blood that goes through the left atrium, past the left AV valve, into the left ventricle, is now on its way to the rest of the body. Before we get there, though, notice the myocardial tissue here. Okay? The walls of this left ventricle are much thicker than that what we see on the right-hand side. This is a very, very powerful structure. Okay? This is our interventricular septum. Interventricular, in between the ventricles. Septum means wall, but notice these muscular walls here. As those ventricles contract again, we're going to push blood, now oxygenated, up through the aortic semilunar valve. Okay? Aortic semilunar valve, which is going to take that oxygenated blood up and out the aorta. One more structure, two more structures I want to point out. This right here is what we call the ligamentum arteriosum. Ligamentum arteriosum once was the ductus arteriosus during fetal circulation. There's another structure that you'll see right here. You can see it from the left atrium. You can actually also see it from the right atrium as well. This is what we call the fossa ovalis. Fossa ovalis in fetal circulation once was the foramen ovale.